All right, I think we are on and live. Good to see everyone. Thank you for joining us today, and welcome to Medicare Made Simple. My name is Jason Dahl. I'm a certified financial planner, the director of financial planning services, and a partner at AFS Financial Group. And on behalf of myself and Alp Adebeck, the founder and managing partner, and our whole team at AFS, we are excited to be here today with chapter. So today we're thrilled to bring you a session that will help hopefully demystify the convoluted Medicare arena. To do so, we have partnered with Chapter, a leading Medicare advisory company, to help our clients determine when and how to sign up for Medicare, identify the best coverage, and compare existing coverage to other available plans. And today's session will help empower you with the tools and knowledge you need to determine the best Medicare coverage to meet your needs, maximize your health benefits, and minimize your healthcare costs. So as a reminder, and I know Ari will mention this as well, but please ask questions at any time during today's session. We've got plenty of time allotted for questions. You can ask questions by typing them into the chat screen. So hopefully everyone has seen that. You saw the note that came through from chapter host there, the welcome note. So if anybody if you're not seeing that, please make sure you can see the chat function. Go ahead and type in a test there if you like. I'm happy to do that. I know one of my favorite questions just before we get started is, can you schedule a time to speak with me or Alp or our team at AFS? And we want to encourage you to directly follow up with us after today's session. If you have further questions or would like to schedule a time to review a few things over Zoom or the phone or in person these days, we love what we do, and the best part of what we do is connecting with people and helping you solve your personal financial planning puzzles. So please don't hesitate to reach out to us. And same goes with Chapter. And I know Ari's going to kind of talk about that, ways in which folks can connect with Chapter. We are more than happy to sort of be that bridge. We're already doing that for a lot of folks to connect you with the team at Chapter. But I know Ari's going to talk a little bit about how folks can learn more about Chapter directly and connect with them. So without further ado, I'm pleased to introduce Ari Parker, Chapter's head Medicare advisor.
Thank you so much. Can you hear me?
Gotcha. Always good to check.
Thank you so much for the introduction, Jason.
Thanks for being here. We really appreciate it.
Absolutely. All right. Just shared the presentation. As Jason mentioned, you can reach out to us at afs@askchapter.com, afs@askchapter.com. I'm going to speak for 10 to 15 minutes. Please interrupt me. I love interruptions. I was a competitive debater, and so we're very used to people having objections, and it's no trouble at all if you want to post a question, and I'll address it if it's relevant. If it's not, I'll wait until the end of the presentation to address it, or maybe you'll be a step ahead of me and it'll be covering something that I'll touch on in a moment. But again, please, all the questions are welcome, and I'm only going to speak for 10 to 15 minutes, so there will be plenty of time for questions. As to why you should trust us, why you should trust Chapter, we have established our authority as one of the country's leading Medicare advisories. We've helped thousands of people sign up for Medicare by breaking down the complex government program into simple, bite-sized pieces. In fact, I'll be publishing a book on September 6th. It's available for pre-order, called It's Not That Complicated: The 3 Medicare Decisions to Protect Your Health and Money. And I'll be talking about points that I make in the book as part of this presentation, but you can also go ahead and pre-order it if you like. Thank you, Carol. Yeah, it is really exciting. My mom is very proud, and she's already reserved her copy. I did get married during the pandemic. We actually just had a second wedding, so we now have 2 wedding anniversaries, but it's the same woman. And you can see our pandemic wedding photo right there. Our grandmothers were able to join us in person, and it was very lovely. We are one of only 2 Medicare advisors that have met the standards of excellence set by the National Council on Aging, which means that which is a very high bar. It means that we advise our members in an ethical way, and that we've met all the qualifications to be an independent advisory. We search across all plans using a database, which I'll touch on in a moment. Our agenda for today is to cover what Medicare is and also what it doesn't cover. Then I'm going to walk you through the 3 decision steps, which is signing up for original Medicare, considering additional coverage, and finally choosing a specific plan. So with that, what is Medicare? This is how Medicare can look like to many people. It's a maze, it's confusing, there's lots of different rules that apply, but I'm going to break it down into simple decision steps so that hopefully it reduces confusion and leaves you in a better spot than you were before this presentation started. What is Medicare? 2 parts to original Medicare. Part A is hospital insurance, which is inpatient hospital care, inpatient mental health care, skilled nursing facility care, and even hospice care. The premiums for Part A are typically fully prepaid. If you paid federal payroll taxes for 10 or more years, then you fully prepaid your Part A premium, and it is premium free to you. There is still a deductible, and I'll touch on that later on. Then there's Part B. Part B, there's a premium for. It's $170.10 for most Americans for this year. What you get in return is 80% coverage for doctor's visits, 80% coverage for specialist visits, 80% coverage for outpatient procedures. For example, my mom just had a knee replacement and original Medicare picked up 80%. The other 20% belongs to you with no out-of-pocket maximum. So Medicare isn't free. There's $170.10 charge for most Americans per month in 2022. What does Medicare not cover? 2 big items. First, there's no financial limit to your exposure. There's no ceiling. You owe 20% of your medical bills, and that amount, sky is the limit on that. The second big item it doesn't cover is long-term care. Long-term care is defined by the activities of daily living, like bathing, eating, dressing oneself, even cognitive decline, and Medicare doesn't include any provisions for long-term care. There have been proposals to add it to Medicare, but none of the bills have made it out of committee. Here's a picture of what your Medicare card looks like. You can see there's an 11-character identifier. That's your Medicare beneficiary ID. It used to be your Social Security. As of 2018, that's no longer the case. There are 2 dates on your Medicare card, and it matches up with your Part A date and your Part B date. If you're starting Medicare by way of turning 65, then these dates will probably match up for you. If, however, you're coming off work-provided insurance and you waited until, let's say, age 67 or 68 to start Medicare, then these dates might be different. Your Part A might have started when you turned 65 because you paid federal payroll taxes for 10 years or more, and you waited to start your Part B because you liked your work-provided insurance. Now, the 3 decision steps. The first is when to sign up for original Medicare. The second is considering additional coverage. Then finally, we're going to talk about choosing specific plans because the plans vary county by county across the United States. In fact, there are over 24,000 options for just this year alone, depending on where you live. With that, step 1, signing up for original Medicare. Oops, I have trigger fingers. When can you sign up for Medicare by way of turning 65? Now, this is a 7-month initial enrollment period that goes from 3 months before you turn 65 and extends 3 months after you turn 65. So 7 months cumulative. And you really, if you know that you intend to start Medicare when you turn 65, it's advantageous to apply right when your window opens. The reason why is we've been seeing a lot of delays with the Social Security Administration since COVID broke out. And it's better to apply early so you have your red, white, and blue Medicare card in hand. You can't apply 4 months early, though. Your window opens 3 months early. So 3 months before you turn 65 is the right time to notify Social Security. Why is it Social Security rather than Medicare? Great question. The reason is because Social Security handles all the paperwork for Medicare. That's just the way that it was established under the Medicare Enabling Act legislation in 1965. Social Security handles the paperwork, so you apply through Social Security to get your red, white, and blue Medicare card. Now, let's use an example here. Let's say your birthday's in December. When can you sign up for Medicare? Well, you can sign up September 1. So your enrollment window opens September 1st. The process takes less than 5 minutes if you apply online. I don't recommend calling the Social Security the Social Security Administration by phone. Their wait times have been over 90 minutes. It's much easier to apply by phone, and it's something that a member of our team can help you with. Takes less than 5 minutes. We have the instructions written out, and we'd be happy to email them to you. if you want to drop your email or book time with us in the chat. And I'll be dropping the link there so that you can book time with us. What about if you're coming off work-provided coverage and are past the age of 65? Well, some special rules apply here. If you're losing your group health coverage from an employer with 20 or more employees, then you will have an 8-month window to sign up for Medicare Part B. The key rule there is it has to be 20 or more employees, 20 or more. So if you're self-insured or you're working for a small group employer, which means 19 or fewer, then you actually have to start Medicare to avoid penalties. You must start Medicare when you turn 65. Now, this 8-month enrollment period, you can also apply online for, and you typically want to apply before your window opens. You want to apply once you know that you have a retirement date in mind. The window opens 3 months before you know you want to retire. And this is the right time to get the ball rolling so that there's no gap in your coverage. Alfonso asks, I have heard that one should sign up or register for Medicare at 64 and a half years of age, otherwise you miss a window. Alfonso, the window actually begins at 64 and 9 months. 64 and 9 months is when the window opens. We're happy to talk to someone who's just turning 64 or is 64 and a half, but really there's nothing to do with regard to notifying Social Security until 64 and 9 months. The second decision step is considering additional coverage. Why do most people choose additional coverage? Well, Medicare only covers 80% of your medical bills at most, full stop, 80% coverage. It is not 100% coverage. So you still owe 20% of your medical expenses plus out of pocket. What's more is that original Medicare doesn't include things like prescriptions, dental, vision, or hearing. So when people realize it has these deficits and that they're going to owe 20% out of pocket with no limit, that's typically where the discussion around additional coverage comes in. Here, there are only 2 options for additional coverage. It's really straightforward. The first option is Medigap. Medigap sits on top of original Medicare, and it preserves your choice of seeing any doctor nationwide who accepts original Medicare. So for example, I recently had a client who they lived in Florida, but they wanted to get treatment for cancer at a very famous cancer research institute in Houston. It was no problem under original Medicare because they had a Medigap plan on top of original Medicare. So they could go from Florida and see specialists in Houston or California for that matter. No issue with that. This is the most, if you're looking for Cadillac coverage, if you're looking for something to give peace of mind without travel restrictions on it, then Medigap is really the way to go. Medigap doesn't cover prescriptions though, so what we would recommend is standalone Part D prescription coverage in addition to Medigap. The reason why it's important to add drug coverage in addition to Medigap is so that you avoid the Part D late enrollment penalties, which I'll touch on in a moment. The second option for comprehensive Medicare coverage is to choose a Medicare Advantage plan. This is also known as Part C or as an all-in-one plan. What people really like about these plans is that they have low premiums. Many have premiums as low as $0. They also include additional benefits like dental, vision, hearing, and prescription coverage. What people like less is that it's managed care. So we have to go doctor by doctor to make sure that each of your doctors are in network with the plan. And we also need to make sure that it has the additional benefits that you're interested in. Marianne, I'm happy to talk about Irma in a moment. Now, an attendee has a question. If I have a pre-existing condition, can I be denied for a Medicare supplement plan? It depends where you live. In 46 states, you have to answer questions about your health history if you wait until after your open enrollment period. Your open enrollment period is the 6 months between starting Medicare Part B. So this is a one-time window in 46 states. In 4 states, New York, Connecticut, Maine, and Massachusetts, you can actually get a Medigap plan anytime without answering questions about your health history. Not the case in 46 other states, though. In 46 other states, if you miss your one-time window to enroll in a Medigap plan, which coincides with starting Medicare Part B, then you actually have to answer questions about your health history, unless another Medigap protection applies. It's something my team deals with every day. So if you have any questions about this, please make an appointment with us. Now, let's talk drug coverage. What is it? It's coverage for prescriptions, and it's called Medicare Part D. The reason why it's called Part D, not just because D is in drugs, but because it was added to Medicare in 2006. So it was added over 40 years after original Medicare, which started in 1966. It's technically optional, but it's highly recommended. The reason it's highly recommended is because there's a lifetime penalty if you sign up too late. And what's considered too late is waiting 63 days after having other creditable prescription coverage. Creditable prescription coverage means it's at least as good as what you would get under Medicare Part D. So how do you get it? There are two ways. One is through a standalone Part D plan. That's what I was talking about when we would recommend, if someone went Medigap, we would recommend adding a standalone Part D plan because original Medicare doesn't cover drugs. The other way to get it is as part of that all-in-one plan, also known as Medicare Advantage or Part C, because then the prescription benefit is typically bundled in. That brings us to our third and final decision step, which is choosing a specific plan. Here are all the options that would be available to you if you live in Queens County. There would be over 21 different Medigap options and 47 different Medicare Advantage options. Now, what differs across each of these Medicare Advantage and Part D options is that the benefits differ, including the drugs that are covered under it. What also differs are the deductibles and copays, the out-of-pocket maximums, and the physician networks, because under Medicare Advantage, you have to go doctor by doctor to make sure that each of them is in network with the plan that you're choosing. So here are the factors we discuss when speaking to a client for the first time. We go over your cost preferences. Would you prefer higher cost upfront, but more peace of mind on the back end because you won't have any copays, you won't need to get referrals to see specialists, and it allows you to travel? Or would you prefer a lower cost plan, but pay as you go insurance, like Medicare Advantage? So cost expectations is really important. The second thing we discuss are doctors. If you go the Advantage route, then we need to make sure that each of your doctors is in network. If you go the Medigap route, we just need to make sure that your doctors accept original Medicare, and almost every doctor does. The third thing we need to discuss are your prescriptions. What prescriptions are you on? The costs vary a lot, whether you can tolerate generics or not, and it even varies based on the pharmacy that you go to. That affects price as well. Even dosage affects price, and of course, the frequency with which you take medications. So we discuss all of those nuances in a 15-minute one-on-one consultation. Then finally, your location and lifestyle preferences. If you have a second home, if you're a snowbird, then you're probably going to want a Medigap plan because that'll allow you to access care when you're at your second home or when you're away for the winter. You should adjust or reconfirm your coverage every year because the plans change every year on the Medicare Advantage and on the standalone Part D side. If you go the Medigap route, though, the saying is marry your Medigap, date your drug plan. Your Medigap plan isn't going to vary because the benefits are standardized under federal law, plan letter by plan letter. And I'm happy to go over that further in the Q&A. But it is important to reconfirm your coverage every year. The fall is the time to do it. You'll see a ton of advertisements. William Shatner will be on your television nonstop. And that window, the annual enrollment period window, is from October 15th to December 7th. So this is a great time to review your Medicare Advantage plan, your prescription drug plan, even your Medigap plan to make sure that the premium increases have been in line with your expectations. Now I want to open it up to questions, but I do want to leave you with my email address, which is afs@askchapter.com. Suhail is also going to drop a Calendly link in the chat so that you can book time with our team. And with that, I'm going to address questions. So Jason asks, appealing IRMA. So let me go unpack what IRMA means. IRMA is the income-related monthly adjustment amount. This applies if you're considered a high earner by the Social Security Administration. So what's a high earner? A high earner means that you file your taxes solo and made more than $91,000 in 2020, or you file your taxes jointly and you made more than $182,000 in 2020. So when would we appeal an IRMA? When would we appeal that amount? Well, if you're retiring in 2022, it might not be so good for you to show 2020 income. Instead, you might want to use your 2022 income So what Form 44 allows us to do is to request that the Social Security Administration use your 2022 income instead. And there are 8 categories in which you can appeal your IRMA. Now, there's an IRMA for Part B, Medicare Part B. There's also an IRMA for Medicare Part D. So there are 2 separate IRMAs. And if you want the IRMA charts, then just reach out at afs@askchapter.com. We'd be happy to send them to you. Next question is from Bruce. Bruce, I think I'd be happy to go over this again if you have any nuances about Medigap versus Advantage. But the takeaway here is that Advantage is managed care, so we have to go through each of your doctors to make sure that you're in network, whereas Medigap sits on top of original Medicare, which preserves the choice and flexibility of doctors because almost every doctor nationwide accepts original Medicare. Kelly asks, do the additional coverages that you choose come out of your monthly Social Security payment? For Medicare Advantage, you can choose to have the premium, if there is one, deducted from your Social Security. However, you cannot use your Social Security to pay your Medigap premium. Great question. Ashok asks, yes, so your benefits, Ashok was a Railroad Retirement Board retiree. So you would actually need to go through the Railroad Retirement Board, but it works the same as going through Social Security for the purpose of getting your Medicare benefits. Alfonso, I'm sorry, I don't understand the question on registering for Medicare versus automatic participation. What I can say here, though, is if you are taking Social Security before the age of 65, then you will be automatically enrolled in Medicare. You will receive your red, white, and blue Medicare card in advance, and the premiums, the $170.10 for most Americans, is deducted right out of their Social Security check. If you're not taking Social Security, then you have to affirmatively enroll through that online link that I mentioned. It takes less than 5 minutes, and you'll be invoiced for your Medicare Part B premiums on a quarterly basis. Carol asks, what if I have an HMO that I like? That's fantastic. You would just want to review your plan during the annual enrollment period to make sure that it's going to work the same way in 2023 as it did in this year. Every year the plans change. Want to make sure that your doctors are still covered in network, that you're still happy with your prescription costs, and that the additional benefits are to your liking. What also changes is that there's competition. So new plans come online and want to make sure that it wouldn't be to your advantage to switch to one of the new options that might be available to you. Let's see. Marianne, the question that you asked about a sliding scale for income is IRMA, the income related monthly adjustment amount. It applies if you file solo and made more than $91,000 in 2020, or if you file jointly and made more than $182,000 in 2020. And as Jason pointed out in the chat, there is a way to appeal it based on this year's numbers. You might wonder, why do I need to wait 2 years? Why are they using 2020? Why aren't they using 2021 or even 2022? And the reason is because Social Security gets your taxes on a 2-year delay. Many people file for extensions, so that's why there's a 2-year look back. So Nicola asks a great question, which is, I love this. We are a 2-person company. This is super important. Paying group rates. Nicola, you are required to sign up for Medicare Part B at 64 and 9 months. If you don't sign up for Medicare Part, because you must start Medicare when you turn 65. If you don't sign up by way of turning 65, then you would have no enrollment period to sign up for Medicare Part B by way of a special enrollment period, because the size of your employer is too small to qualify. What's more is here you can keep your group insurance if you like, but your group insurance becomes secondary. Medicare becomes primary. And that's why you must sign up for Medicare, because Medicare steps in as your primary insurance age 65 and beyond. So you can still keep your group insurance, but your group insurance pays secondary. So what happens if you didn't sign up for Medicare? Well, your group insurance could start denying claims because they would say, we're not required to be your primary insurer anymore. Medicare is responsible as your primary insurance for 80% of these claims. So they can refuse to pay the 80% of claims that Medicare would have otherwise been responsible for. What's more is if you delay, then you are subject to a late enrollment penalty. So it really puts you in a bad spot if you wait to sign up for Medicare Part B and work for an employer with 19 employees or fewer. Paul asks, I have original Medicare and Medigap. Great. What are my best options for obtaining dental and vision? A standalone dental and vision plan would be the answer here. Original Medicare doesn't cover dental or vision. It does cover medically required things related to your vision. For example, cataracts would be the classic example. But it doesn't require, original Medicare doesn't cover corrective lenses, for example. Ingrid asks, if I choose Medicare Advantage, but later find myself traveling for a couple years, can I switch to Medigap temporarily? The answer is, if you're healthy enough, it depends where you live. If you live in 46 states, then you can answer health questions and get a Medigap plan. The advantage here would be that there'd be international travel coverage. And this really helped a client that I had who was traveling in Paris last month and suffered a heart attack. The heart attack cost $35,000, but because he had a Medigap plan, his Medigap stepped in and covered 80% of his bills. Now, there are some restrictions here on Medigap as when you're outside the United States. The first is that it only covers you for the first 60 days that you're outside the US. So it's perfect for a vacation, but if you're planning to live outside the US, it's not going to apply past the 60-day mark. The other thing is that there's a $50,000 lifetime cap, $50,000 lifetime cap on the Medigap travel benefit outside the US. And then Ingrid, just to address the temporary portion of your question, yes, you could have it temporarily and then go back to a Medicare Advantage plan. Alfonso asks, I take Social Security now, not yet 65. And yes, Alfonso, if you're receiving benefits from the Railroad Retirement Board, then you'll be automatically enrolled in Medicare and you'll receive your red, white, and blue card 3 months before you turn 65. Nicola asks, what is the difference between a replacement plan and a supplemental plan for Part B? So, Alfonso, let me address your question in a moment. So to Nicola's question, there are two options here. One is Medigap, which sits on top of original Medicare and allows you to retain choice of doctor. The second option is Medicare Advantage. This is the bundled all-in-one plan that is a replacement for original Medicare because it's administered through a private network of doctors. So it's managed care and it's pay-as-you-go insurance. So there are co-pays associated, deductibles associated, and it's still better than having original Medicare only because it sets a maximum out-of-pocket, which is good. Original Medicare doesn't have a maximum out-of-pocket, but we do need to make sure that your doctors would be covered in network. Alfonso, I think it would be, I'm sorry, Alfonso, I mixed you up with a shock. A shock worked for the Railroad Retirement Board. Alfonso, if you're taking Social Security benefits, then again, you'll be automatically enrolled in Medicare when you turn 65, and you'll receive your Medicare card 3 months before you turn 65. And then the month that you turn 65, $170.10 if you make less than $91,000 individually, or $182,000 if you file jointly, will be deducted from your Social Security income. Virginia asks, what is the cost of Medigap? It depends where you live. And this is why it's helpful to have a database that shows all plans nationwide, because here we can look at what options are available to you. And we can even see, we can price how the predicted, premiums that you would owe from age 65 to 85 and ask the carrier exactly how much you would owe if you were age 70, age 75, for example. And from there, we can build an expected sum of premium index. And we can discuss that one-on-one. Bruce asks, a different advisor via benefits advised needing to have Medicare Part B in place before being able to choose a Medigap plan. That's correct. That's correct. You need to have started Part A and Part B in order to choose a Medigap plan. Same goes for Medicare Advantage. You need to have Medicare Part A and Part B in place to choose a Medicare Advantage plan. You don't need to have Medicare Part B in order to choose a drug plan. Having just Medicare Part A is sufficient to choose a standalone prescription drug plan. Alfonso asks, can you explain why the government charges me for coverage if I don't take it? You can choose not to enroll in Medicare. That's your choice. The question would be, how are you planning to pay for your healthcare expenses past the age of 65? The other question would be, if you get sick and you choose to enroll in Medicare, then what enrollment period would you use to start Medicare in that situation? There'd be penalties that would apply there too if you didn't have creditable coverage, which means working for an employer that has 20 employees or more. This is your choice, but it's just important to understand the consequences if you don't enroll in Medicare. What else? These are great. Jason, I love the question on health savings account. Very important rule that applies to health savings accounts, which is you must discontinue making contributions to your health savings account when you start Medicare. So if you're turning 65, that means discontinuing contributions at the 64-year and 11-month mark. And this is as simple as just telling your health benefits coordinator, your retirement coordinator at your company that you want to discontinue making contributions. Now, what if you want to continue making HSA contributions because you intend to remain on your work-provided insurance past the age of 65? That's no problem. But you must then discontinue HSA contributions 6 months before you apply to enroll in Medicare. This is the most complicated rule that is on the books. It's very helpful to work with an advisor to make sure that you discontinue those contributions. And if you'd like to work with an advisor, if you'd like to book time with us, then Suhail is just going to drop a link so that you can make appointments. And I'm just pinging him to make sure that we get that link. Paul asks, I am interested in the answer to a question posed by Virginia. What happens if you're not sure where you're going to be living within the US? Then this is exactly where either a Medicare Advantage or this is where a special enrollment period would apply. When you move, you would be entitled to choose a different plan depending on the circumstance. And yes, there are Medicare Advantage plans that have more flexible coverage. Some of them, in fact, have a nationwide network of doctors even, but it really depends on the county that you live in, because these plans vary county by county across the United States. Jason asks, can I use my HSA funds to pay Medicare premiums? Yes, HSAs are great. They're triple tax advantaged. You can use them to pay your Medicare Part B premiums. You can use them to pay for any qualified medical expense, including your prescription drug plan, any pharmacy costs that you might have, and any doctor's visits. The only thing that you can't use them for is to pay your Medigap premiums. You can't use your HSA funds to pay your Medigap premiums. You can use them for any other qualified medical expense, including paying your Medicare Part B premiums. Yes, Alfonso, if you're covered under your spouse's work-provided insurance, then you would have a special enrollment period to enroll in Medicare to get your Part B to sync up with when your spouse is choosing to retire. That's right. So when we refer to work-provided insurance, if you're a spouse, then you can certainly choose to remain on their work-provided coverage. What's important here, though, is normally there's a higher cost share for a spouse. Typically, the premiums here are a lot more expensive than for the actual person who's working at the firm. So if you're the spouse, then typically these premiums can be several $100s, if not more, in which case starting Medicare Part B might be a better value for you than remaining on your spouse's work-provided insurance. This is something that we built a calculator for. It's actually a complicated analysis. We have to know your premium, what your spouse is contributing per paycheck, and we want to make sure that it's per paycheck to get the true monthly cost of what it is to cover you on their insurance. We also want to look at the deductible. If it's a high deductible plan, then Medicare is probably going to be a better value because a high deductible plan means $5,000 to $6,000. Some of them have a $10,000 deductible, whereas the annual deductible for Medicare Part B is only $233. So if you went the Medigap route, for example, you would not see a Medicare approved expense after the first $233 per year for 2022. The number might go up for 2023, but still it's a very low deductible. That's the point. So Nicola's question is about the enrollment period windows. Typically, people who are, because her work provided coverage, their enrollment period is February 1st, but typically there's an exception to these enrollment periods by virtue of turning 65 and becoming eligible for Medicare. And remember, because Nicola's employer is a small group employer, that is, it has 19 or fewer employees, then her coverage becomes secondary and Medicare becomes primary. The system is designed so that people on small group insurance start Medicare and Medicare becomes primary payer. Jade, great. Jade asks about whether IRMA is checked every year. Yes, it's a 2-year look back. So 2023 will be based on 2021. 2024 will be based on this year. It's a 2-year look back. And if you want to appeal your IRMA, it's a straightforward process. It's Form 44, and I'm happy to send it to you. Just reach out, afs@askchapter.com. But if you have a one-time, let's say you sell your house and you made $1 million that year, that would actually count for the purpose of determining your income-related monthly adjustment amount. But it would be a one-time, it would just apply for that year because you probably didn't sell another $1 million property the following year. So it would be automatically readjusted at the end of the year. Any other questions? There's no charge for our services, Paul. Ashok, Ashok's question is on how IRMA, the income-related monthly adjustment amount, is calculated. It depends on how you file your taxes, solo or jointly. If solo and you made $91,000 or less, you don't need to worry in 2020. You don't need to worry about it. If you filed jointly and you made $182,000 or less in 2020, then you don't need to worry about it. It's only if you made more than those amounts that you would need to look into what your income-related monthly adjustment amount would be. Nicola asks, are there any considerations if you own your own company? Yeah, the big consideration would be the size of the company. So Nicola, if it's just you and someone else, that's small group insurance, in which case you would want to start Medicare Part B because your small group insurance will refuse to be primary payer for 80% of your claims because Medicare is what they can deny claims in the event that they should have been secondary payer rather than primary payer. And starting Medicare is really important here because that's your window to sign up. All right. Great questions. Thank you, Bruce.
Hi, everyone. I'm Suhail. I'm also on the chapter team. It looks like the questions are slowing down. Want to thank Ari, and also more importantly, want to thank AFS Financial Group. They're close partners of ours, and we work closely to support them and everyone they support as well. So thank you to the team. As mentioned, if you ever want to reach out to Ari or ask questions that you can forward to the group, please reach out to this email, and then Jason can share if there's other opportunities to reach out to the team. And I'll repost again, should you like to schedule an appointment, a link you can use to connect to get more information. Through our partnerships with AFS, you get to work with Ari and a few dedicated experts, and they're free, right? But thank you, everyone, and I'll hand it over to Jason. Thanks, Jason and team, for hosting us.
Yeah, thanks, Suhail and Chapter and Ari for an awesome session. I mean, that's not easy, getting peppered with all those questions and being able to respond. We really appreciate you doing that, and yeah, look forward to your book. And if anybody, I definitely encourage folks to use that Calendly link to schedule a time for a one-on-one session to really dive into your own unique situation. As we've mentioned several times, you can also send an email to afs@askchapter.com, and somebody from the chapter team will get in touch with you. Or, of course, you can always reach out to me or Alp or anyone on our team here at AFS, and we'll connect the dots as well. So, and yes, we are. This recording of this session will be available. Thank you for reminding me, Natalie. So we're going to make that available to everybody who signed up, and we'll also have it posted on our resources page on our website.
Yeah, I have to say, these are really the best questions I've received in a presentation.
All right. Yeah, there's wide ranging and big picture down into the weeds, and it's good stuff. And I know to date, anybody that I know that's reached out to your team at Chapter and had a one-on-one consult has given us very good feedback. So we appreciate that and appreciate having the partnership.
Thanks, everyone. Us as well. What I'm going to do now is, we'll share the, with Jason and your team, we'll share the recording afterwards that you can share with the group. But for the time being, I'm going to end the session. And if you have any other questions, you can use the email, reach out to Jason and the AFS team, or reach out to us directly. Thank you, everyone.
All right. Be safe, everyone. Thanks, Ari. Thanks, Suhail.